This is the University of Hawaii Maui College, the college on Maui.
So today we're going to talk about the most difficult aspect of pharmacology, autonomic pharmacology. And as we go through autonomic pharmacology, I want you to think about dividing the pharmacology into 4 different categories. Now we're going to talk about all of this, but I just wanted to give you a little introduction for you to think about as we go through. And so there are really only 4 things that you need to remember in autonomic pharmacology. We're going to talk about drugs that increase the sympathetic nervous system response. We're going to talk about drugs that increase the parasympathetic response. If you don't remember anything about sympathetic and parasympathetic, there's some reading in your resources section, 2.2 autonomic reading, I think that's what it says. Be sure and take a careful look at that so you know the difference between sympathetic and parasympathetic nervous systems, and I will talk about that today. Well then, of course, we can use drugs that block the sympathetic nervous system response, and we can use drugs that block the parasympathetic response as well. And so if you can keep these 4 categories in your mind as we go through the pharmacology, hopefully you will be a little bit less confused. Here is my representation of the sympathetic nervous system right here. This gentleman is running away from that woolly mammoth, and so he is our sympathetic nervous system mascot. You guys might know the sympathetic nervous system response is the adrenaline rush. If you've ever had fear or anger or stress and feel your heart beating and your blood pressure go up, that's your sympathetic nervous system at work. And the sympathetic nervous system is half of your autonomic nervous system. And by the way, the woolly mammoth, her sympathetic nervous system is in full gear as well. And of course, this is the opposite of the sympathetic nervous system. So this gentleman right here, he is our symbol for the parasympathetic nervous system, which is kind of like the opposite of the sympathetic nervous system. Please do not get parasympathetic confused with sympathetic. They pretty much have opposite effects on organs. And so the parasympathetic nervous system, we're going to call that the rest and digest system. Parasympathetic nervous system is to help us relax, repair, and renew and digest. It's pretty obvious that we get way too much of this and not enough of this. And so that's something I want you to keep in mind as we go through this lecture. So again, we're going to divide the autonomic pharmacology into 4 categories: drugs that increase the sympathetic response, drugs that stimulate or simulate that adrenaline rush, and then drugs that increase the parasympathetic nervous system response, drugs that increase the rest and digest system. Well then, we're going to use drugs, we're going to talk about drugs that block that adrenaline rush. And we'll talk about these drugs when we talk about antihypertensives. When we use drugs to treat high blood pressure, we'll talk a lot about drugs that block the sympathetic nervous system response. And then our last category, we talk about drugs that block the parasympathetic response. And so to belabor the point, I want you to view things again in these 4 categories. We're going to talk about sympathetic agonists. Remember, agonists activate the receptor, and so sympathetic agonists are going to simulate this response right here, simulate or stimulate the adrenaline rush system. Or we can have parasympathetic agonists that stimulate the rest and digest, repair, and renew system. Of course, we can have exactly the opposite thing occur. We can have drugs that are sympathetic antagonists, sympathetic blockers. They're going to block this adrenaline rush. They're going to block that system that's raising our heart rate and blood pressure. And then again, we can use drugs that block the parasympathetic response, parasympathetic antagonists. And we're going to talk about all of these. Something that's very confusing about these four categories is that you will notice similar effects because the sympathetic nervous system and the parasympathetic nervous system have opposite effects. Oh, that's okay, they can see. Sympathetic agonists, you're going to notice, have similar effects as parasympathetic antagonists, and this is generally where I lose everybody. And again, you will notice that these two types of drugs have very similar effects. Sympathetic blockers are going to have very similar effects as parasympathetic agonists. And so that's what today's lecture is about, and trying to shed some light and alleviate some confusion. So drugs that increase the sympathetic nervous system response, we're going to call those sympathomimetic. And that means to mimic or imitate the sympathetic nervous system response. And so look out for that word sympathomimetic. Sympathomimetics have all sorts of other names, and we'll talk about those in a second. But keep in mind, this response right here, drugs that cause that response, are called sympathomimetic, mimicking the sympathetic nervous system. Well, drugs that increase or mimic the parasympathetic nervous system response, we will call them parasympathomimetics, because they mimic or imitate or increase the parasympathetic nervous system response. Drugs that decrease the sympathetic nervous system response, we will call them sympatholytic. Lytic means to stop or break down. So sympatholytics decrease or block sympathetic nervous system response. So we can call these sympatholytic. We can also call them all sorts of other names. Sympathetic antagonists, adrenergic antagonists as well. But I wanted you to be familiar with these terms as we go through. And then our fourth category, drugs that decrease the parasympathetic nervous system response, that block the parasympathetic response, we call those parasympatholytics as well, because they decrease or block the parasympathetic nervous system response. So if you can keep all that in mind as we go through that, you'll be doing great. All right, so let's talk about this autonomic nervous system. Autonomic just means automatic. You do not control your automatic nervous system. You do not control your autonomic nervous system. It works automatically. So you can worry about other things like pharmacology. And so the autonomic nervous system controls the function of many organs automatically, so you don't have to. And this is why many drugs that affect the autonomic nervous system affect many organs. And I say that at every lecture. But to make sure that you remember, and if you don't remember anything else from this lecture, remember this right here. Drugs that affect the autonomic nervous system are going to affect many organs. So don't be confused by that. And when we open up the forum section after this lecture, I want you to go through and see how drugs within a single class, even though they have different names and different uses, they all share very similar properties, because drugs that affect the autonomic nervous system affect many organs. Speaking of forums, which hasn't started yet, but we will start today, this is an actual forums posting that I got from a student last semester. People asked me, how do you know people watch lecture? Well, I read this posting in forums last semester. I had no idea that this drug affected so many organs, affected many different organs, and had several uses. Dr. Farmer should cover this in his lecture. So I can tell who is watching lecture and participating, I assure you. Make sure you remember this. Drugs that affect the autonomic nervous system affect many organs and have many uses, and we're going to talk about that today. So make sure you get your flashing yellow highlighter out, and remember this. If you're completely lost the rest of the time, please remember this right here. Drugs that affect the autonomic nervous system will affect many organs. And here's a list of them right here. Heart, blood vessels, the bowels, your gastrointestinal tract, the pancreas, the ureters, or the drains coming from the kidneys to the bladder. The bladder, for that matter, the bladder is affected, for that matter, by the autonomic nervous system. Your eyes, your pupils, your lacrimal glands, that's what makes tears, your salivary glands, your lung, airways, all of these systems are controlled by the autonomic nervous system. So drugs that affect the autonomic nervous system will affect these organs. And don't be fooled, because if we give the medication to do something with the heart, well, don't be surprised if the blood vessels, the bowels, the pancreas, the ureters, the bladder, the eyes, the pupils, the lacrimal glands, salivary glands, and lung airways are affected as well. If we give a drug to affect the lung airways, please do not be surprised if the heart, blood vessels, bowels, pancreas, livers, bladder, eyes, pupils, lacrimal glands, salivary glands are affected as well. What you want to have happen, we call the effect, and all those other things that you don't want to have happen, they call those side effects. I'm here to tell you right now they are all the effects of drugs. So as you go through the form section when we start that, and you look at the effects and the side effects and the unwanted effects of the medications, see that these organs are usually involved. Please do not confuse the autonomic or automatic nervous system with the peripheral nervous system. The peripheral nervous system is just quite simply the part of the nervous system that's outside of the skull and spinal cord. When we talk about the peripheral nervous system, we're usually talking about neurons that end on an organ and a muscle, or we're talking about sensory neurons. Please do not confuse the autonomic nervous system, abbreviated ANS, with the central nervous system, abbreviated CNS. We're going to talk about CNS, central nervous system pharmacology, after exam 2. Central nervous system just means the brain and the spinal cord, and something that you will notice about the central nervous system is we're talking about neurons that communicate with other neurons. Please do not confuse the autonomic nervous system with the voluntary nervous system. The voluntary system means willing, like to volunteer. You do control your voluntary muscles. Your striated skeletal muscles are there to volunteer to do what you tell them, and so that's the voluntary nervous system. You do not control your autonomic nervous system, not very much at least, because it works automatically. So like I said, we divide the autonomic nervous system into two systems. The sympathetic nervous system, also called, you might call it the adrenaline rush. Many of you know what the adrenaline rush feels like. That's your sympathetic nervous system at work. And we call that the fear, flight, fight system. And then the parasympathetic nervous system is kind of the opposite of the sympathetic nervous system. We call the parasympathetic nervous system the rest and digest and repair and renew system. So please, as we go through this, make sure you know the difference between the sympathetic nervous system, which is responsible for that adrenaline rush, and the parasympathetic nervous system, which is there to help us rest and repair and renew and digest. Well, let's get back to my sympathetic nervous system dude right here. Can you guess what's happening to his organ functions? Well, I'll give you a hint. The running part is voluntary, kinda, but everything else that's going on with him is completely automatic. And her sympathetic nervous system is on full tilt as well. Avoid fatty foods, eat plenty of vegetables, and get lots of exercise. I think that was the point of this cartoon. So what's going on with this dude? Well, his heart is pounding. And that is the effect of the sympathetic nervous system, especially the effect of adrenaline, also called epinephrine. Epinephrine's the same thing as adrenaline. Please don't forget that. And so his heart is pounding because the sympathetic nervous system can increase heart rate and increase the strength of contraction. So let's talk about adrenergic receptors. The heart has a nerve that goes to it from the sympathetic nervous system. We'll just call it the sympathetic neuron, and that neuron releases norepinephrine. If you've not watched the last lecture, 2.1 neurotransmission, then you're probably already lost, and you should probably watch that lecture before watching this one. But that's okay. The heart has a neuron coming from the sympathetic nervous system, and norepinephrine, the catecholamine that comes from the amino acid tyrosine, norepinephrine is the neurotransmitter that comes from that neuron. But the heart is also able to sense adrenaline that comes from the adrenal gland. Notice adrenal above the kidneys, adrenaline, and that's where that adrenergic comes from, adrenaline. So there's an organ on top of the kidneys. The adrenal gland is going to secrete adrenaline into the blood, and adrenaline is the same thing as epinephrine, and the heart senses that and really speeds up heart rate and force of contraction. And on the heart are adrenergic receptors, adrenergic like from adrenal, like adrenaline, and those are beta receptors. And in this course, we're going to have two types of beta receptors, beta 1 and beta 2, and the beta 1 receptors are on the heart, sensing the norepinephrine that's coming from the sympathetic neuron, and they're also sensing the epinephrine that's coming from the adrenal gland. So what else is going on with this dude? Well, his blood pressure is sky high. When you're sitting around and relaxing, your blood pressure should be normal, and we'll talk about normal blood pressure next time. But when you're being chased by a woolly mammoth that's trying to stomp on you, I can assure you your blood pressure is sky high. And this is the effect of the sympathetic nervous system and the effect of epinephrine, adrenaline. And the reason that blood pressure goes up is because of the systemic blood vessels. This is supposed to be a picture of the blood vessels in the body. These are the legs, and these are the arms, and there's the aorta. And the blood vessels are going to constrict. They're going to tighten. And when we make the blood vessels smaller like that, that shoots the pressure up. If you think about it, if you take a garden hose and turn the water on and let the garden hose squirt straight up, the garden hose will shoot about that high up in the air. But if you take your thumb and put it on top of the garden hose and make the opening smaller, then you can shoot the water in the garden hose way high up in the air. So making the tube smaller raises the pressure that's coming from the tube. And so by constricting blood vessels, the sympathetic nervous system constricting blood vessels is how the autonomic nervous system is able to raise blood pressure. And so those blood vessels have adrenergic receptors too. The blood vessels, smooth muscle is what shuts and opens those blood vessels. And that smooth muscle has a nerve, they have nerves running to them from the sympathetic nervous system as well, and they sense norepinephrine. However, those receptors are especially sensitive to adrenaline coming from the adrenal gland, and when they sense that adrenaline, they really clamp down, shooting the blood pressure up. And so those receptors on the blood vessels, those are adrenergic alpha receptors, and in this course we have to have two alpha receptors as well, alpha 1 receptors. So if you can remember, beta receptors are on the heart, alpha receptors are on the blood vessel, you'll be doing better than about 99% of the people who take a pharmacology class. Well, what else is going on with this guy? Well, his heart's pounding, his blood pressure's sky high. Well, his lung airways are open. They're wide open because he needs the increased ventilation due to the increased metabolism of his muscles working so that he can survive. And so now his lung airways are wide open. And this is the effect of adrenaline or epinephrine coming from the sympathetic nervous system. And how does that happen? Notice epinephrine, adrenaline, opens lung airways, relaxes smooth muscle. We got the opposite smooth muscle effect with systemic blood vessels, and here the lung airways are opening with the effect of the sympathetic nervous system. And so that's something you're going to want to remember as we go through this. And there are adrenergic receptors on the long bronchioles as well. Those long bronchioles open and close due to smooth muscle action, and they too are innervated by a sympathetic neuron, sympathetic neurons that secrete norepinephrine to open them up. But those lung bronchioles, you can mark that out and put lung bronchioles, also sense adrenaline from the adrenal gland, which is the same thing as epinephrine, and those lung bronchioles have adrenergic beta 2 receptors on them as well. So if you can remember, the heart has beta receptors, the lung has beta receptors, but different beta receptors, and the blood vessels have alpha receptors. You're going to be doing great in this class. Well, his need to run away is life and death. And so we are shunting his body through its autonomic nervous system, is shunting blood into his muscles. How do we increase blood going to the muscles? By shutting the gastrointestinal tract down. He doesn't need to rest and digest. He needs to run away. And so the blood to his gastrointestinal tract is stopped. Stressful things like surgery, stressful things like childbirth, even though you're asleep and listening to nice relaxing music like Tool while you're getting surgery, your body is still very well aware that something traumatic is happening to it. Your body still releases the epinephrine into the body during surgery, during stressful events like delivering babies and other forms of trauma. And that's why after surgery, after delivering babies, after anything really, really stressful, the gastrointestinal tract shuts down because the sympathetic nervous system thinks that your muscles are much more important than what you ate when you're running away from the woolly mammoth. So one of the things that adrenaline, epinephrine, does is shut down the gastrointestinal tract, shut down blood going to the gastrointestinal tract. And digestion essentially stops. Well, another thing, since he is running so fast, he needs to worry about where he's going, and we can tell that his pupil is dilated so that he gets a maximum amount of information coming into his visual system. And so one of the things that epinephrine, adrenaline, and the sympathetic nervous system do is dilate pupils. So why are all these changes occurring? Well, it's the sympathetic nervous system, and those neurons use norepinephrine, mostly norepinephrine, a little bit of epinephrine, but in this class, one neurotransmitter is enough. The sympathetic nervous system is using norepinephrine to do all those things that I told you: dilating eyes, dilating lung airways, constricting blood vessels, increasing heart rate and heart contractility, shutting down gastrointestinal tract. That's due to the sympathetic nervous system, which uses norepinephrine. Well, the adrenal gland, which sits on top of the kidney, when it senses that the sympathetic nervous system is activated, it starts releasing adrenaline, epinephrine, and it gives that sympathetic nervous system that super extra boost of overdrive that we need to do the things that we need to do when we are under stress. Adrenaline is the same thing as epinephrine. Notice that adrenal word. Now I'm going to tell you right now, this adrenaline comes from the middle of the adrenal medulla. It does not come from the outside of the adrenal. The adrenal cortex is actually kind of like a different organ. A lot of the organs that we talk about when we talk about endocrinology are going to be two organs in one, separate functions that have been put together. So when we talk about the adrenal, we're not talking about the outside, we're talking about the inside of the adrenal medulla. And so you'll hear it called adrenergic, like adrenal, like adrenaline, adrenergic neurons, or the adrenergic system. So we talked about drugs that increase this system as being sympathomimetic. You might also hear them called adrenergic agonists as well. And so there's a reason there are several different names for everything in this business, and I don't make that stuff up. I'm just here to try to explain it to you. There's my sympathetic neuron secreting its neurotransmitter. All of this is much more complicated than what I am explaining to you, but this is how I want you to understand it in this course. And so once the adrenal gland senses the sympathetic neuron doing its thing, the adrenal gland releases adrenaline, epinephrine, to kick the whole system into overdrive and really raise blood pressure, really raise heart rate, really open lung airways, really dilate pupils, and shut that gastrointestinal tract down so that our muscles get plenty of blood. That's what the sympathetic nervous system does. And so when we talk about drugs that increase the sympathetic nervous system response, you can expect all those responses that we get from the dude running away. When we block all those responses with adrenergic antagonists like beta blockers and alpha blockers, then we can expect the opposite effects of what I've just discussed. I think I just said this. Adrenergic agonists, adrenergic agonist drugs, adrenergic agonist substances are also called sympathomimetics, okay? And so don't be surprised. You look at one book and it'll call it adrenergic agonist. And you look at another book, it'll call the same drug a sympathomimetic. Or maybe you'll look at another book and it'll call it an alpha agonist. Or maybe another book will call it a beta agonist. Or maybe they'll call it a sympathomimetic adrenergic beta agonist. All right, so don't be afraid of all those words just saying the same thing. And so adrenaline, epinephrine, we're going to use it as a drug, and it is our adrenergic agonist. We're going to use it for all sorts of things. Increase heart rate, constricting blood vessels to raise blood pressure, dilating lung airways, dilating pupils. We can use it for allergic reactions as well, for those of you who have an EpiPen. We're going to talk all about that in the forum section. So don't be surprised. Epinephrine, adrenaline has a lot of different uses because it affects different organs. Well, albuterol, the drug albuterol, is an adrenergic beta agonist. All right, it's a sympathomimetic adrenergic beta agonist, a beta 2 agonist for those of you keeping score, and it's a drug used in asthma. It's that yellow rescue inhaler that people who have asthma, when their lung airways are feeling spasmed or tight and they're having a hard time moving air in and out of their lungs, they'll use that yellow inhaler that has albuterol in it, and albuterol is an adrenergic beta agonist. It opens lung airways. And what else can we expect from that albuterol, besides bronchodilation, besides opening lung airways, will increasing heart rate and increasing blood pressure is a side effect of using an adrenergic agonist. But again, it is just one of the effects that we can expect when we use a sympathomimetic, when we use an adrenergic agonist. Well, we're going to use adrenergic antagonists. We're going to use sympatholytic drugs like beta blockers, beta adrenergic antagonists or beta blockers. And we're going to use those drugs when we talk about hypertension, when we talk about high blood pressure. All right? But notice that beta blockers can cause bronchodilation. So beta blockers are commonly used to treat high blood pressure. Beta blockers are also used to treat glaucoma, which we'll talk about next time, hopefully, and that's due to high eye pressures. But do you see why beta blockers can make asthma worse? Remember, beta agonists are what open lung airways, so beta blockers can constrict lung airways, and that's why we have to be very careful about using beta blockers in people with asthma. And so they talk about cardioselective beta blockers, meaning that they block the beta receptors on the heart, hopefully more than the beta receptors on the lung. Even though they call them cardioselective, meaning we're going to block the receptors on the heart, they still are able to block all of the beta receptors, but they have more activity on the heart. So even cardioselective beta blockers can make asthma worse and cause bronchospasm. If you can remember that beta blockers are commonly used to treat high blood pressure, and our main concern with those beta blockers is bronchospasm in asthmatics, I guarantee you, you will get a gold star when you take the boards. All right, so we talked about the sympathetic nervous system and sympathomimetic drugs and sympatholytic drugs, drugs that block the sympathetic nervous system. But we've only talked about half of the autonomic nervous system. And so let's talk about the other half. And that would be the system that does the opposite. So what is the opposite of this? I've already given away that hint. It's this right here. We get way too much of this, and certainly not enough of this right here. So what's happening to this guy's heart rate? It's due to his sympathetic tone. What's happening with his blood pressure? Well, I'll tell you right now, his heart rate is dropping because the parasympathetic nervous system slows heart rate down. Because that's part of resting and digesting. It's hard to rest and digest when you feel your heart beating in your chest. All right, and so because we're resting and digesting, we can use less blood. We don't need so much blood being swished around, and that's why our heart rate's going down. And what's going on with his digestion? Well, he's starting to move that food around, and we'll hear gurgling in his tummy if you sit in this pose and really rest. You'll probably notice that your tummy will start to gurgle as well because the parasympathetic nervous system stimulates the bowels to start moving and absorbing nutrients, because that's part of renewing and repairing. That's why we call this the rest and digest system. I think I called this the rest and digest system already. Well, I'll tell you right now, the parasympathetic nervous system uses acetylcholine or acetylcholine, depending on who you argue with. And so the parasympathetic nervous system uses acetylcholine. And throughout the parasympathetic nervous system, muscarinic receptors are what are on the organs that sense the acetylcholine coming from the parasympathetic nervous system. I gave you 2.2 readings, and they're going to have all sorts of interesting, fun things that you can read about the sympathetic and the parasympathetic nervous system if you want to know exactly how it's wired and where the exceptions are to what I've told you, so you can be even more confused. All that reading is in Katsung, and there's some reading in your resources section as well. But if you can remember, the rest and digest parasympathetic nervous system uses acetylcholine as the neurotransmitter and muscarinic receptors, muscarinic, that should be an A right there, muscarinic receptors, then you'll be doing great. So let's talk about cholinergic agonism. Parasympathomimetics are also called cholinergics because of acetylcholine. So cholinergic agonism is also called cholinomimetic, also called parasympathomimetic, all sorts of different words just to suggest the same thing. And a drug that we will talk about in the form section, bethanechol. Bethanechol is a cholinergic muscarinic agonist. Muscarinic, that should be an A right there. Cholinergic muscarinic agonist. And so you'll look up bethanechol in one book and it'll say it's a parasympathomimetic. And you'll look in another book and it'll say it is a cholinergic drug. And you'll look at another book and it'll say it's a muscarinic agonist. And that all just means the same thing. And bethanechol is commonly used to stimulate bowel and bladder function. Remember, the effects of epinephrine can shut the bowels and the bladder down, which is common after surgery, which is common after women deliver babies. And sometimes if we can't get the bowels and the bladder working again after something traumatic or stressful like surgery, we can use a cholinergic agonist, a muscarinic agonist, a parasympathomimetic, a cholinomimetic to stimulate bowel and bladder function. Well, to make things incredibly complicated in here, we can do this thing called indirect cholinergic agonism. And that's the use of acetylcholinesterase inhibitors. I talked about acetylcholinesterase in the last lecture. Acetylcholinesterase breaks down acetylcholine. So if we block the thing that breaks down acetylcholine, if we block the garbage disposal that gets rid of acetylcholine, we're going to end up with more acetylcholine, and that as well is cholinomimetic. That's considered cholinergic. So acetylcholinesterase inhibitors block the breakdown of acetylcholine, and this increases acetylcholine levels. So acetylcholinesterase inhibitors are cholinomimetic. And half the people who take exam 2 miss this question right here, even though I say it over and over again. And it's because these are very difficult concepts to understand, and it may take you 20 years and teaching pharmacology for 3 years for you to have as good an understanding of it as I think that I do. Well, and we'll talk about these drugs, these cholinomimetic acetylcholinesterase inhibitors in the forum section. And one of them is neostigmine. Look for that stigmine word or stigmine word because you'll see acetylcholinesterase inhibitors will have stigmine on the end of them. So be on the lookout for that. Something else that is acetylcholinesterase inhibitors are toxins like insecticides, and those are called organophosphates. organophosphates. And so the reason that we use organophosphates to kill insects is insects use acetylcholine as well. Insects have acetylcholinesterase to break down the acetylcholine, and when we block the breakdown of acetylcholine, the insect's acetylcholine levels go up to toxic levels, and it kills them. This is why organophosphates are toxins to insects and toxins to humans as well. Well, let's talk about cholinergic antagonism. Atropine. I'll tell you right now, the treatment for organophosphate poisoning, being poisoned by excessive levels of acetylcholine, is atropine, the cholinergic antagonist. If you don't learn anything in this class about a single drug, please learn something about atropine. People who write board questions, they love atropine, and atropine has so many different uses in the clinical setting that it gets very confusing. So atropine is our classic cholinergic antagonist, our parasympatholytic, our anti-muscarinic, muscarinic antagonist. You'll see all those terms used to describe atropine, our cholinergic blocker, our anti-cholinergic drug. And so you'll hear atropine referred to as a cholinergic, muscarinic, that should be an A right there, antagonist, anti-cholinergic, anti-muscarinic, parasympatholytic. And so don't be surprised if you see atropine, our cholinergic antagonist, used or described in all these different ways. So what can we use atropine for? Well, we use it to speed up heart rate. Atropine is used in emergency bradycardia, and we'll talk about that when we get to 2.6, because the parasympathetic nervous system slows heart rate down, giving atropine, which blocks the parasympathetic nervous system response, is a great way to raise heart rate back up. Atropine also causes mydriasis because the parasympathetic nervous system closes the pupils. That's called meiosis. Atropine opens the pupils, and that's called mydriasis. And I think I explained that in just a little bit. Atropine is used in diarrhea. In diarrhea, the bowels are moving the fluid through too quickly, and we can use atropine to slow that down because it blocks the parasympathetic response. And atropine is also used for organophosphate poisoning. Organophosphates are acetylcholinesterase inhibitors. Acetylcholinesterase breaks down acetylcholine, and organophosphates prevent that from happening, raising acetylcholine to toxic levels, and we can use an acetylcholine blocker, an anti-muscarinic, anti-cholinergic, parasympatholytic atropine for organophosphate poisoning. In asthma, we can use both beta-agonist I talked about with albuterol, but we can also use anticholinergic drugs, cholinergic muscarinic blockers in asthma as well. And sometimes both these drugs will come in a single type of inhaler. Like Duoneb is a drug that's used for asthma, and it contains two drugs that are commonly used in asthma. Albuterol, I talked about, is a beta-2 agonist, a sympathomimetic and adrenergic beta-2 agonist. But something else Duoneb has in it for asthma to bronchodilate is ipratropium. Look at that atropine word right there in ipratropium or ipratropium. All right, see that atropine word? Anticholinergic, cholinergic antagonist, muscarinic antagonist. So you might hear it called anti-muscarinic or muscarinic antagonist, or you might see somewhere where ipratropium is called a parasympatholytic. I assure you that it is not my fault that the human body is so complex and the pharmacology is complex as well. It is your fault for being such a complex creature. Oh, come on. It's simple. Everything that we're talking about is either going to make the heart rate go up or the heart rate go down. Everything that we talk about is either going to make blood pressure go up or blood pressure go down. Everything we talk about is going to make eye pressures go up or down. Lung airways are going to either open or close. The drugs we talk about are either going to cause the bladder to relax or the bladder to have more tone, be less relaxed. Everything we're going to talk about is either going to stimulate the gastrointestinal system or slow it down. Sure, some of the drugs aren't going to do all of these things all at once, but when you are going through the autonomic forums, I want you to keep in mind all the effects of the drugs are going to be these right here. Sure, some drugs won't do this or won't do that, but you'll see all of these things in common as you go through autonomic pharmacology. So let's talk about some medical terminology that you're going to see as you go through the autonomic drugs. Dilating the pupils is called mydriasis. And there's my mydriasis, nice dilating the pupils. And there's two ways to go about that. We can either use sympathomimetic adrenergic drugs to dilate pupils, epinephrine. Not a great drug to dilate pupils, but epinephrine does dilate pupils. Or we can use an anticholinergic parasympatholytic drug like atropine, which blocks the parasympathetic nervous system to cause mydriasis. And this is what is so confusing about this section, is because we can use an agonist for one system or an antagonist of the other system to get the same effect. So constricting the pupils is meiosis. Not the same meiosis as cellular division. This is spelled differently. And so there's my pupillary constriction right there. And again, sympatholytic adrenergic antagonist drugs can block or can cause meiosis, make the pupils smaller. But something else that can do that is the cholinergic drugs as well. The muscarinic drugs can cause meiosis. We can, if we use sympathomimetics or parasympatholytics, we can cause dry eye. And so you'll see dry eye as a side effect of some medications, because sympathomimetic drugs, adrenergic drugs, can cause dry eye. So can anticholinergic drugs as well. Well, some drugs like adrenergic blockers or cholinergic drugs can wet the eyes, can stimulate the glands to make tears. So we can either use sympatholytic adrenergic antagonist drugs or more likely we can use cholinergic drugs. So acetylcholinesterase inhibitors are commonly used to treat dry eyes to stimulate tear production. Well, if you are taking this class to be in the dental hygiene program, something they want you to know is dry mouth is the most common side effect of any medication. And that's because so many medications are either sympathomimetic when so many other medications have anticholinergic properties, and so this can lead to dry salivary glands. So sympathomimetic adrenergic drugs or anticholinergic parasympatholytic drugs can cause dry mouth, and for those of you in dental hygiene, this is the most common side effect of any drug because these drugs are so commonly prescribed. Well, we can have the opposite, the blocker of the if we use a drug to block the adrenergic system, or we use a cholinergic drug, we can stimulate salivary glands. And so sympatholytic adrenergics can cause or can stimulate saliva production, but many times we'll use acetylcholinesterase inhibitors, raising acetylcholine levels to treat dry mouth and stimulate saliva production. And these will all be things that you'll see if you watch carefully in our forums section. Well, sympathomimetics or anticholinergics can dry upper airway, upper respiratory mucosa. Sympathomimetic adrenergic drugs like decongestants. You can get decongestants over the counter. Those are sympathomimetics, and they dry and decongest upper airway. But the anticholinergic like atropine, the parasympatholytic atropine, we can use that during anesthesia to dry respiratory airways during intubation. So both of these are a possibility. And with exactly the opposite, adrenergic blockers or cholinergic drugs can stimulate the upper respiratory mucosa and make it more wet. Well, we talked about asthma. We can use a sympathetic agonist, an adrenergic agonist, a sympathomimetic like albuterol, or we can use an anticholinergic like ipratropium, or we can use both to cause bronchodilation in the lungs and open lung airways. So I know you'll see this on a test question, and traditionally half the people miss this, and hopefully all of you will get it right this time. Sympathomimetic adrenergic drugs like albuterol can be used to open lung airways. Epinephrine as an inhaler can be used in an emergency room in an emergency setting to treat asthma. But we can use anticholinergic drugs to cause bronchodilation as well. If we take the exact opposite, things like beta blockers or cholinergic drugs can cause bronchoconstriction and bronchospasm, constricting that smooth muscle to shut down lung airways. That's especially problematic in an asthmatic. So when we have somebody who has asthma, we have to be very careful about using things like beta blockers. We also have to be very careful about using cholinergic agonists, because both of these classes of drugs can cause bronchospasm. Well, drugs that cause tachycardia are called positive chronotropes. Fast heart rate, fast meaning positive, chrono means time, like a chronograph is a watch, so a chronotrope speeds the heart rate up. And both epinephrine or any sympathomimetic drug or something like atropine, the anticholinergic, can speed heart rate up. So don't be surprised when you see sympathomimetic adrenergic drugs being used to speed heart rate up. Do not be surprised when you see atropine, our anticholinergic parasympatholytic drug, being used to speed heart rate up, because both of these classes of drugs can cause fast heart rate. And drugs that increase the force of contraction are considered positive inotropes. Ino for energy, meaning that these drugs cause the heart to beat stronger. Unfortunately, in this class, just the sympathomimetic adrenergic drugs are what we'll talk about for positive inotropes. Well, drugs that cause bradycardia, slow heart rate, are called negative chronotropes. Chrono, time, and so negative chronotropes slow the heart rate down. So don't be surprised to see sympatholytic adrenergic antagonists, beta blockers, will slow the heart rate down. But so will cholinergic drugs. Drugs that mimic the parasympathetic nervous system will slow the heart rate down as well. And drugs that decrease the force of contraction are considered negative inotropes, and in this class, the beta blockers will be our negative inotropes for the most part, and we use other drugs as negative inotropes as well. Well, fortunately, your parasympathetic nervous system does not innervate our blood vessels, so we don't have to worry about that with blood vessel. So vasoconstriction is going to raise blood pressure, and sympathomimetic drugs like beta agonists and alpha agonists, especially the alpha agonists, raise blood pressure by causing vasoconstriction. And then vasodilation, relaxing arterial smooth muscle, will cause blood pressure to drop. Opening up those blood vessels, opening up those tubes, causes the blood pressure to drop. And so we will use sympatholytic adrenergic antagonists like alpha blockers when we drop blood, when we want to lower blood pressure. And we're going to do that next time when we talk about hypertension. Well, some drugs are going to relax the gastrointestinal tract and slow peristalsis. Sympathomimetics do that, but so do anticholinergic drugs. So both sympathomimetic adrenergic drugs can slow down the gastrointestinal tract. Epinephrine slows down the gastrointestinal tract. That's why people's bowels quit working so well after surgery. They quit working so well after a big major adrenaline rush. But don't be fooled. Anticholinergic drugs are going to slow down the gastrointestinal tract as well. Now, some people who have gastrointestinal spasms, if their gastrointestinal tract is working too fast, causing things like diarrhea, we can use atropine, our anticholinergic drug, to treat diarrhea, to slow peristalsis, to relax the gastrointestinal tract. But some drugs, like sympatholytics, adrenergic blockers, or our cholinergic drugs, they can stimulate peristalsis in the gastrointestinal tract. We use bethanechol, our cholinergic agonist, to stimulate the gastrointestinal tract when it's slowed down too much. And you will see that cholinergic parasympathomimetics, cholinergic agonists, muscarinic agonists, we commonly use those to stimulate the gastrointestinal tract. You'll notice the cholinergic drugs have a big effect over the gastrointestinal tract. That's why you'll see cholinergic drugs used much more for gastrointestinal tract, and you'll see the sympathetic drugs used more for heart and blood vessel cardiovascular things as well. And if you read carefully, and I won't talk about it too much, but when you're running away from the woolly beast, you need extra glucose. And so drugs that affect the autonomic nervous system are going to affect pancreas and glucose release as well. We'll talk about that a little bit when we get to endocrinology. And so drugs that relax the bladder and the urinary smooth muscle and slow peristalsis from the ureters coming from the kidneys to the bladder. This is an effect that we can get from either sympathomimetics or anticholinergic drugs. So people who are having bladder problems, sometimes anticholinergic drugs will make it worse. And so both sympathomimetic adrenergic drugs and anticholinergic parasympatholytics, antimuscarinics, can be used to slow ureter peristalsis and relax the bladder. And so we would use an anticholinergic drug if somebody's suffering from bladder spasm. We want the bladder to relax a little bit. However, things like alpha blockers, which are great blood pressure drugs, can also stimulate the bladder if the bladder does not have enough tone, or we can use cholinergic drugs like bethanechol to stimulate the bladder if the bladder does not have enough tone. But mostly what we'll use is cholinergic agonists, muscarinic agonists, parasympathomimetic drugs to stimulate the bladder. Well, hopefully that wasn't too confusing for everyone. Hopefully there's a rewind button somewhere on your device, and you can watch that again. That being said, that's more than enough today. When I come back, we'll talk about hypertension and drugs to treat high blood pressure. Until then, aloha.
This is the University of Hawaii Maui College, the college on Maui.